For the organization of this event, for us is very satisfactory to work jointly with the Commission. And without further ado, I also want to thank you the participation for all people who will expose in this webinar. And I will pass the floor to Dr. Patricia Redondo, who will make the presentation of this webinar, as he's the Secretary for the American Commission on Occupational Risk Prevention. I wish that this activity can be very exceptional, can help effectively from the designation and for the objective. I know that we will give important data, and also for the accomplishment for this occupational risk prevention for a more healthy work environments. Welcome, everyone. Good morning, good afternoon. It's for me grateful to welcome Dr. Emilio Carrasco for the Inter-American Center of Studies on Social Security, and all the members who are here from all region members. And also to manifest for you that it's a pleasure for me as a technical secretary for the American Commission on Occupational Risk Prevention, as known as the CAPRT, to introduce you to this seminar that we have prepared for you. And also, it is named Good Practices for a Good Management and Safety Health Environment. That will be implemented to the week for the Social Security Day. And incorporate the 28th of April as the Occupational Risk Prevention Environment. For me, the CAPRT has a mission to prevent culture prevention for occupational risk environments, and also for the members for the Inter-American Social Security Conference through the research, training, and technical assistance. With the help for the Inter-American Center on Social Security Studies, CS. And also we work with the generation and transmission of knowledge for the productive employment, enforce for the promotion of health in an occupational safe and healthy environment for our employees. For the commemoration for the Safety and Health Day, this topic is very important for the ILO, which is a specific, secure, and healthy environment as a principle and a right fundamental for the employees, in which it is placed in June 2022, where the ILO decided to include a healthy environment in the framework for principles and fundamental rights in the occupational environments in the ILO. And Articles 158, 157 for the safety in the environment, occupational health environment, and for the fundamental laws that all countries which integrate the ILO has the commitment to accomplish with independence for this ratification. For the ILO, it's important that to have this acknowledged consciousness for the stakeholders to provide to the employees and dignify occupational employment that cannot provide the integrity for the occupational health. That's why that there is Inter-American Commission for Occupational Risk Prevention, and it's important to depend on the health environment just to prevent the risk, and then takes all the measures, reasonable measures, to reduce the risk in an acceptable level. And also when the prevention is integrated as a part of the organizational culture, by preparing this seminar of 3 sessions that will contribute to all people who join us today. And also that prevents to provide the good practices and dependencies for the safety and health occupational in the work, and also for the gender perspective and disability to guarantee a good preventive management for secured and safe health occupational environments. Without further to say, welcome everyone for the American Commission on Occupational Risk Prevention. And we also thank you for your interest from all of us, from all of you, for the safe and healthy for your employees. So I will start making the presentation for our first speaker, dominated secure and healthy occupational safety occupational environments, which was being taken by Roman Nigna Roman Ramos, who is a specialist in occupational and environmental medicine from the National Autonomous University of Mexico. He completed his medical residency at the Mexican Social Security Institute, Pranavit. He has participated in professor for the medical personnel in training in the specialty of occupational environmental medicine. And he has been assigned in the different stages of the certification process for the coordination of occupational health coordination. Thank you very much, Dr. Roman, for being here with us. Please go ahead. Thank you very much for your presentation, Dr. Arredondo. Good morning, everyone. We thank you the invitation for this interesting panel. Today, we provide good greetings from our Dr. Reina. So I will talk on behalf of her. So I will try to talk about the safe and healthy work environments. Without nothing to that here, I will start the presentation. What is ELSA? ELSA is a voluntary safe and healthy program, which is created by the Mexican Institute for Social Security just to implement strategies and actions to enhance health and health for employees and also for productivity and quality in work environments. The objectives of this ELSA program is to improve the health and well-being of workers' environment, which is focused on the main healthy or disease, which is distributed into different two action lines, which I will present after this presentation. So it intervenes three sources of the occupational environments, and also the Mexican Institute of Social Security Institute as provider for Social Security for workers in the companies and their employers. This is a free of charge program and not punitive. The principal objective is to increase health for employees to prevent risk, psychological risk prevention and economics, and also for chronic degenerative illnesses and work diseases. Improve productivity, since this is the main active for the companies are the employees. As I mentioned before, the ELSA program is implemented by three course of actions. This is a joint effort by the same institute to integrate the strategies that can promote safe and healthy work environments. The 10 course of actions also intervene principally in 5 of the ones we are working on in the we were on that we will talk after this. So basically, what we have here is the prevention of work accidents in hand and ankle, prevention of musculoskeletal disorders in the back, occupational health surveillance, prevention of occupational diseases related to risk factors at work, promotion of health and well-being in the workplace, vinculation or connection with social security centers, culture, sports addiction prevention, preventives in the company and social prescription, and large-scale training with claims awards, and use of technology and ELSA and interoperability of M systems. As I mentioned before, these course of action are based on the principal lines of action as Mexican Institute for us providers or agents that cause the principal diseases and accidents in employees. What does ELSA offer? This is into the position of companies just for the implementation for security and health and well-being for workers. This is just to provide the companies in an easy way through platforms, virtual platforms, in which they can be held by checklists, support material, and technical sheets, or just to know how to take actions for well-being for employees. Suppose tools that can provide to make analysis in work centers just to intervene according to results that can provide tools that we have been providing them. And also we have claims courses that can be, you can learn from the platform. It is just to have easy access to this platform and just to facilitate the tools, the virtual tools of the new technologies. So everyone from anywhere and at every hour can have courses, a free charge courses. And also we have distinctive ELSA, which is a knowledge that is provided by the Institute for the companies who have main characteristics for the strategic of ELSA strategic. And also, the main point is very a good advantage that the Institute provides for the ELSA program is the training that we provide to the companies. These are optional that can be every company can ask for it virtually or on site in workplaces just to receive training for each of action lines for each of the main topics that I mentioned before. Specifically, we're working in 5 mainly points that we will talk in them after this. And also for the optional free and cognitive advice of the dashboard to visualize the evolution of disabilities. It means that for employees to know what lesions or diagnoses or diseases that are intervened that can provide more of unemployment days because they cannot go to the work due to a disease. And all of these things can be analyzed. So what are the main things that provoke that the employers are not going to work, and just to establish a line for strategy and to make recommendation of interventions that can help in healthcare well-being. And also we have geographic reference. Through this geographic reference, I will also talk about after this that there is a very important tool just to identify according to the space within the country, what are the options that we can offer for training for health laboratories or health laboratories and social security and occupational environments that can provide an institute. From this checklist that I mentioned before are 5 from the line of actions. The first one is the prevention of work accidents in hand and ankle, prevention of musculoskeletal disorders in the back, occupational health surveillance, prevention of occupational diseases related to psychological risk factors at work, and promotion of health and well-being in the workplace. These are composed in a series of items or points that the company can review every of them to review of them if they accomplish or not accomplish all of from the identification or acknowledge or evaluation from the same controls that we can have here for the prevention of every of these agents that we have identified as a major incidents that can affect the population health. As I mentioned before, this list at the end while the company ask or check this checklist they can accomplish for the company through a platform, so they can log in through a computer or laptop or a telephone, just to can learn from the company list, and they can recognize if they are accomplished without the list. And the list that can provide a percentage of accomplishment for every of the list of accomplishment lists. As I mentioned before, these are the five main tips. So we can see here a general framework. So there's all the five lists taken into consideration that can be based on the standards, the Mexican standards from the safety and health occupational systems that are based from the completion of every of those lists. And this is a self-evaluation. This list, first of all, the company can fill it out with the employee or the person that can be trained in the company, or the person who has been assigned to accomplish these tasks for health and environment systems in each of these workplaces. Also, this support material can be found in ELSA platform. Companies can log into ELSA platform in the web platform. So each of these lists, they were provided to help tools that can provide companies or commissions of social security or health security companies, or the person who be in charge of this workplace in each unit. So we have developed a support material based on the list. So just to see what are the points that are missing from these materials, so they can see or develop in a better way according to the official standards of for the geographic references, or some research that can be done from every of the list points. If a stakeholder or stakeholder company don't miss these points. So we have it talking about the prevention of safety or health risk for the psychosocial risk. And of the main points here, some of the conditions of risk, a work rhythm for the activities of family work activities. So we have explore what are the main standard for this item. So we can talk about what is this item about. So we specify and also mention how the company is. So what the company has to do to accomplish and to put them in the conditions that can be uh, better for the workplace. And also we have support material as tools that can help us to the evaluation for the occupational risk. Like this can provide tools or some backup for that can be useful when they review what risk or what risk factors can found in their workplaces. For example, if they learn from the webpage, they can upload, for example, for psychosocial risk factors, they can see here the reference in guide 2 or reference guide 3. So they can see a result according to what the standard implies for the economic risk factors, or the method for the technical guide for the National Institute of Social Security and Hygiene. So you can upload this paper, and then you can provide the information, and automatically you can see the document for the evaluation of the tool. So the person responsible for this area, they can see the corresponding list that can be effective for the workplaces. Through these support tools, we also have here all the other section that help us to risk prevention. This is in based of the find method, so it is can also be uploaded from the document in the website. And the company can describe all risk in their workplaces, and also can write the consequences or the exposition or probability, and they can see the result to have it in as a reference when they establish the measures or the controls. applying for each points that have been established or identified in each of the workplaces. This material is found in the platform in which the company can access. The company can upload or can log into the website. They can review all of this. Until this section, the company can view this in the website for all the tools that we provide them. So the company can do a self-application or self-evaluation for their workplaces. And also we have many courses that are beneficial for the population that are developed in the platform and the Teams platform. These claims courses are for the prevention of hand and ankle accidents, a course for mentoring for secure and healthy occupational environments, and also for occupational diseases related to psychological risk. These are being orientated for the hand and ankle prevention risk, disease prevention, because the company can, or all population or person can log in this course and it will facilitate to have a more comprehensive knowledge what are trying to identify or what are trying to identify the risk factors, what are disease uh, accidents in the workplace, or what are the main and on-call or skeletal disease, or what are psychological social risk. So in the framework on the company for the prevention of risk prevention, so we can also to see what are the list of the same employers or employers. So there are the main information, so they can provide information from some factors or risk factors that can be identified that can be related to a certain condition that at the beginning they cannot see it before. And also we have monitors for healthy and safe environments. So we will talk about this after this, about this course. Monitors course have to do with all of these things that we can see here in the screen. Distinctive ELSA is a recognition of companies of the Mexican Institute that have the responsibility to carry out actions for a health and safety and well-being workplaces for their working population. These are distinctive that are provided to companies that make a self-evaluation from the 5 lists I mentioned before, that the recognition list. From their results from the self-completion, they can get a greater qualification or less qualification, more than 60% of every of those lists. If the company who are joined to this or registered to ELSA course make the self-evaluation in each of the 5 lists have more than 70%, and also within this workplace have one person that can be part of the social security team, which has trained as monitor or has training to monitor courses into safety and health occupational systems. This person can make this evaluation within the 5 list, and this person can obtain the LSA distinctive. Since this company has been compromised to provide health and safety systems for employers. This distinctive can get for each workplace. If each company has 3 facilities, if they have one person responsible as monitor, or this person who has knowledge to be monitor for healthy and safety environments, can follow this ELSA program in the workplace, and also can get each company can get a distinctive of ELSA distinctive. This is valid for 1 year. The intention for this program is that every self-evaluation or each time they can renew or verify this course or the acknowledgement of this evaluation. And the controls of the work environments can be less, just to update the information according to the current standards. And also, I also have to share with you this point. This is the part for consulting. All the things that I've mentioned before, this is a part of the things that the company do by itself. So we provide all the tools within the platforms of the systems, so they can have here these actions or to follow this action process to look for implementation to the healthy and safety environments. While after they make the self-evaluation or they learn from these programs, or they make the internal programs for the enhancement for the workplaces, we as an institute, we can provide the consulting program. The consulting program are provided by consultants for the health and safety occupational environments. This contact is via email, so we can provide the service through consulting for companies that we know that they can make self-evaluations through the list in ELSA. So we provide them that the physicians, and also we also have physician specialists in traumatology, in psychiatry, and also we have physicians in security, physicians specialized in well-being and health, physicians specified in some secure environments, so they can go to the companies or the workplaces and make the analysis or the checklist for the list with the expert list that the working companies have. So to recognize the companies, what are the main things that can they implement for the main things that we have identified before from this list. One of the best things that the facilities that we have here is that there is an option to that the specialists can go is on site or virtually. This is one of the main things that we are taking advantage from the technology to cover as much as possible in the workplaces, the companies, or the people who are interested in this program. These programs are optional. The company is not obliged to take this process or this course. It is not obliged that the specialist can go to the company workplace. So this is a great opportunity or a great option in which the stakeholders can take this with good qualities, so they can they have spread the results of this program. So because the specialists can train or give recommendations, so they look for to transmit information, so other companies, other people also can add to what we are doing. As I mentioned, just to take the occupational care list or documentation, and also for social well-being. One of the main tools that we like a lot, and also companies like a lot, is that when we show the tables of the evolution of disabilities. As I mentioned before, you as a stakeholder, you can verify that in your company, the majority of the employees have disability because they have a hand disease. So from this, since you acknowledge that this person have lesions or musculoskeletal back diseases, you can start identifying what diagnoses are starting to have, and what areas are having these problems. So from this, what are the diagnoses that you can do internally in your company, and what changes the conditions or the controls you can provide in your workplace to diminish all these disabilities in the future. In the future, to review what are the identify the reason why they are having these disabilities. This is focused for the prevention and acknowledgement for risk factors that can allow us to make actions. If you already have identification for lesions and temporal for risk factors, we also have here this information, and you share with the stakeholder or the company, and we can provide that we can identify that are the main the risk in the company, so you can enhance and to take actions to reduce this risk. The other thing is a referenciation. So we have here a map, geographic reference map, so you can look for a recreational area that have the institute swimming pools, like well-being units for training or health laboratory risk or occupational laboratory training that can find in the page is free on church. So we can learn from in the page in the reference geographic page. So we write down the data and then we can find where we are located. ELSA also have great benefits for the companies where the specialists go to the companies or physicians or engineers. The company have less cost in the consultations since the company is providing them into the context from the company, since they have the employees affiliated to the IMSS. So they spend less in case they need consulting or training for diagnosis for the company. So this can help a lot with this advice document for the person who visit the workplace also. The Mexican Institute for Social Security calculate the risk premium from all these elements for the company's risk according to the sinistrality. For example, for the work diseases that have every of the workplaces or patronal registers for each company. Each time when the ELSA activities are done, we can see the diminishing from accidents and diseases. So this is beneficial for the risk quota for the beneficial things. One of the variables that can be used for the calculation for the institute are useful. So this is beneficial for the companies from the economic field. And also allows to establish or specialized consultancies for the companies who don't know the knowledge what are the social security is. So with the list that we provided, we can guide them step by step of what they have to accomplish according to the principal points that we manage, as mentioned before, for the health diseases, the main health diseases in the institute. If the company doesn't have any knowledge about how to prevent a risk in hand or ankle, they can review all the list item by item so they can see in which way they can, in the way when they can accomplish of the list to diminish these stress factors. So this web page is very friendly, good friendly for user, and we have support materials so they can consult and learn from this information, so they can understand in a more detailed way. So how they can accomplish for all the items we have here in the list. And also from this list, we can generate the main tools I already mentioned before, just to make an analysis for the prevention of a psychosocial risk prevention, or also for the prevention of the flying method to have the diagnosis for security and health that help to identify the risk factors. So we can provide all the tools that the company from a small and that have 10 employees can establish the recommendation or the measures that can benefit for the workplace. And also the training for workers or expert people, accompaniment to implement preventive actions that reduce accidents, and also by engineers or claims courses that can be done in every time, everywhere. And also preventive medical checkups in Prevenims in companies. Prevenims is a structure that we have in the institute that we have nurses and also employees that can go to the companies. They take checkups for the glucose, for the weight, cholesterol, triglycerides. They make recommendations for the physical recommendations, especially for the health that may manage for all the companies that we have in ELSA. From the launch of ELSA in May 2022, it means for the last year, Nowadays, we have more than 7,619 member companies for the LSAP programs. From this, we have more than 7,000 in distinctive, ELSA distinctive. So the companies that have done this list in their workplaces, so they have accomplishment for the self-evaluations with more than 60%, and they have monitors. So we have more than 7,000 distinctive. And also that have been provided for our specialist, and we have provided more than 34,138 advice granted from all over the world, the country, and to have more impact of more than 2,616,647 working people benefited. So we also have more to do. We have to work more in this sense to provide more tools, to provide more opportunities, or more opportunities for the companies to have a health impact for the employees. And also, I want to conclude this my presentation in respect to ELSA course. Thank you very much for your attention. Have a great day. Thank you very much, Dr. Rahman, for your excellent presentation. So I think that you have a great initiative that all people that we are here representing different countries. And also we have to copy your information and to implement in our countries, implement in our employers' health. Before to continue with our next speaker, I would like to tell you if you want to make some question in the chat below, you can write it down. And at the end of the session, we can give you the opportunity of some minutes for our speakers so they can answer all the questions that you may have. So we'll continue to present for you the next exposition or the next session for the gender approach and safety and health approach in the work environment, which is in charge of Master Marina Ortiz Lopez. She's a manager for the National Institute for Safety and Health at Work. She works at the National Center for New Technologies in Madrid, Spain. She studied psychology and holds a master's degree in occupational risk prevention at the University of Granada. She's currently undertaking a PhD at the School of Health Sciences and is a member of the HUM research group in the same partner university. So I give the floor for Dr. Marina, which was talk about a good topic for the health and safety, occupational health and safety. Go ahead, Dr. Marina. Thank you, Patricia. Good morning, everyone. Or good afternoon, everyone. I'm Marina Ortiz. First of all, I would like to thank to the Inter-American Conference on Social Security for the invitation, for being here for the Safety and Health Institute, for being part of this webinar, and also for the Inter-American Commission for Health and Safety Risk Prevention. This is a theme that is very necessary for safety and health management. These are the objectives that I try to apply in my presentation. I will translate it into a strategic implementation, so how to integrate the gender acknowledge. So just to acquire the theoretical framework, a criteria related to the integration of the gender perspective and occupational risk prevention, and also to raise awareness of the need to manage occupational risk with a gender perspective in masculinized and feminist sectors. And I also want to start this session that for me is very important to talk from a theoretical framework, because theoretical and conceptual framework are almost the same. And it's certain that we have less tools that can integrate into design, into the gender perspective. So it is very important to take into account that with an interpretation or adequate vision for the reality, we can make use optimal use of these tools and to integrate this gender framework to the preventive evaluation or risk evaluation, and also for the integration or the consultational elimination. First of all, I would like to talk about the topic about the androcentrism. I don't know all the professional profile of all the speakers, so I apologize myself. And sometimes I talk about some topics that you don't know. So in this conceptual framework, I will try to talk about the perspective of gender perspective and in the labor environments. So the androcentrism is a gender perspective. So it is imply they talk about to imply the men into the work environments. So the skills of women are not seen. So this is something that affected all levels in the research investigation level or preventive level in the practice also. And also it is important to make it visible or the invisible thing and to take into account all those things that women have that in sometimes are considered in the labor environment. The androcentrism, as I mentioned before, affects all levels and also affect all areas, not only for the social security or safety and health, occupational safety and health. Also, in occupational risk prevention can be very visible in the use for the individual prevention tools. These equipment are designed that can based principally for the anthropometrical man gender, so the women cannot go into this section. And also, we have a great androcentrism in the formative framework into health occupational system. I don't know exactly the framework for all countries, but something that I think that every country have in common is the normative framework. As reference, they take into account the men as a reference that are specified contracted to M1, so the women can make invisible or displace. And also for the disease, the occupational disease risk, these risks are for the sectors are masculinized. And also we can see here in the limits for some the position for chemical deposition. However, integrate the general optical gender system, it can generate great androcentrism that can have here nowadays in the safety environment. Sometimes this risk that they can find regulated in the standards are some risks that are more masculinized. So, for example, in the ergonomics field, they act in an optimized manner in case of manipulation of a charge, or also for force positions for the mitigate this risk of the occupational risk. Or also we can think in the position, the exposition to a psychosocial risk. So how the women can be more exposed to this psychosocial risk. So these are those risks that where there are no normal standard development. We can see here that we can start with a vicious circle where we can have a prejudice where the work that are done by the women are considered secure. For example, for the service sector, in a team for women in the industry or construction company is more given to for men. So what happened here in this kind of sectors or this kind of services in this tertiary sector, we have a preventive or inadequate preventive management, which is not sufficient. So there is a lack of a specific accomplishment for the gender approach. So some environment that are proper for women, it is not visible. So women that go to their physician, all physical diseases or physical pain are attributed to all factors for exaggeration. So what happened here? These things are not rejected as professional contingencies, or it is considered as common diseases. And we also go back to the first topic that where the work the majority of people who work in these environments are women. So in these preventive risks are not priority to women. And also, these they have great consequences. For example, when women are not acknowledged or they not acknowledge their diseases as professional diseases, so they recognize are common diseases for even though they have many costs or they can affect the economical field, and also for the field, the preventive field. So we can access to all the workers and teams that are segregated. So we have here that integrate the gender perspective is to consider in a systemic condition the different situations, working conditions, and needs of both men and women. So for this, we must to incorporate specific objectives, and that can be go to the all actions at all levels and in all phases, and also planning, execution, and evaluation. So now, how can integrate gender into occupational health and safety management? So it's very important and fundamental to integrate this obstacle to have a reality for the workplace. So what are the situation of women and men during the workplace? So to provide the same conditions for women and men to disaggregate and analyze by sex and gender. For this, as technical professor for social security and occupational safety and security, so we have to train and educate and look for explanations for the differences by sex, and also for those that are more attributable for gender inequalities between women and men. So are gender inequalities. As I mentioned before, I don't know exactly what are the framework from all decisioners, but it's very important to take into account the difference between sex and gender. Many times I have seen that these all two concepts are very confused. It's very it's important to distinguish them as to go into differences. So they will have to give a biological difference that are mainly cultural and they can construct during the time. In this sense, we talk about sex, we have referring to all biological differences that exist between men and women. So we have very different. So we have the differences biological, and these differences can't be changed. So these social cultural changes that exist between all the sex and gender. So this has been learned from the culture or socially. So it can also vary or have differences in between countries. And when we talk about when we were born women, so we have to go for to be a woman. I also have here an example by analyzing these two concepts, sex and gender, into the position for 15 and 20. So it is considered that women are more perceptible to have a thyroid function due to a genetic condition. However, women's for the exposition for certain chemical exposition, it is more percentage than WEM. So for this use for chemical substances are accumulated into, they can accumulate more fat. So we can see here the women have more 15% more fat than men. So the expositions of certain dissolvents, they are more dangerous for women versus men. And finally, just talk about the influence that the estrogens that have into breast cancer. Uh, Women have more estrogens in comparison with men. We don't have this difference between biological difference between gender, and also for the maternity lactancy that we will talk about after this. And also this social cultural construction that exists if they born men or women. So they have here a draw from my Greta Barner, Aitana Barner. Greta is a signed child. So Greta asked her to draw a child, a girl and a boy. So in this design, the boy have a ball. have they have short hair, while the girl has associated that they have to grow the dress or a lipstick. This image is show that we are able to stereotype or make stereotypes for the gender. So the stereotypes referred more for these ideas that we already have from the culture. So the men are considered to be more fair, and also women are very delicate. So these are all the roles that men and women have in a differential way in all the society. So this association, marital association for women, it is influenced to the sanitary sector, and also for cleaning will have been associated to the women stereotype for health or caregiver women. And also, we will talk about the multi-exposition for chemical products, taking into account and analyzing this gender role. First of all, what happened here in sometimes is that we can see here the multi-exposition for women. Imagine when they do cleaning activities, or they have double shift. When these women go to work, they continue working using cleaning products, so they can see here multi-exposition. And also there is a gender thing in since women used to use more beauty cosmetics or perfumes or dyes, and also they have more sensibility into exposition for certain chemical agents. For the multiple chemical sensibilities for women, and also just for a psychosocial risk for the general, for example, some alterations or diseases are breast cancer. There is a great or largest evidence that women are more affected or more affected for psychosocial risk. And also, just to conclude for this topic about the difference and the importance to determine different scenarios for between gender and sex, we have a pathology that is called carpal tunnel syndrome. This is a disease that is associated to women, also for people who are clean, or and it's associated for the hormonal problems, and also for scientific literature. As I mentioned before, women have a 50% more possibility to have an alteration of the thyroid function. And also, at its gender level, we also have the repetitive movements. As you can imagine, in a certain employ jobs, they can have to do repetitive movements, and this is imply more for women. So it is because women are more delicate, and repetitive movements are more associated with the generation of the carpal tunnel syndrome as professional disease. Starting this point, is very important for us to talk that the sexual division at work. So we can see here that also occurred in all countries, even though they have certain differences. And also to make reference to the distribution of the work, or remunerable work or non-remunerable work. Remunerable work are associated to men, while the remunerable work are associated to women between cleaning or or housekeeping work. These things actually is much sized. We have not compared women into the labor market, but the domestic task cannot have this same equilibrium or optimal equilibrium into a labor or housekeeping work. So this is found as the sexual division at work. So this data that I offer are the last survey for the occupational conditions. But when the employer that we can see here in this slide repeated into other survey that have a decision for all the time changement. So we can see here that the women dedicate more time for a non-remunerated work versus while women prevent more or work more for remunerated work. So we can consider women with child. We can see here that the women increase the time while they work for the remunerated work, and some type of work for household or remunerated work, while the men can just focus into remunerated work. In addition, all the time for they imply for remunerated and non-remunerated work, women have more time implied in comparison to men. For this scenario that we already talked of before, this is a thing that is repeated into a variable related risk. So we can see here that the conflict family work. So the concept work family, as the name mainly exposed, is this position of the simultaneous exigence in the occupational activity and the domestic work, and also for the behavior for women. And this is a concept that focused into the simultaneously of the exigence. And it can be done for the women when they do work jobs. So it is a demand that is associated to the family or care environment or field. For example, while a woman is working, so they can take calls while the school from their children, because the children have something certain illnesses, or even when we talk about that they have a mental charge. This concept of a double presence, also they have this integrated into the origin for the gender perspective and also for the class perspective. What happened here is that for the precarious work is where we can see this double presence. So I will talk about this after in a few minutes. What happened here for this double presence is that not only it is associated to the time invested into between family and work, but also these mental chores that are suffered by women while they're organized or the management of certain activities between family and the work. For example, when they have to cook daily, etc., or these activities all have to be in charge from women. And also, we have here some certain concepts to differentiate the gender perspective. Uh, these differences into job have a segregation. This segregation and have this inequality of distribution for certain sectors and activities, but also for job positions. Just imagine the example for a gardener. For this job position, we can observe how they are more exposed into a risk for job risk due to the use of some equipment, since the women take time to work in certain other activities. For the plants, for example, this is something that require repetitive movements. So these conditions of work in the same work environment vary between the activities that are managed by women and men. So also we have here, as you mentioned, as you can see before, we can see here this aspect when there are gender gaps between men and women. The historical model, it's a model which is established into a social way. So I will explain now from the bottom to from left to right, and bottom to upwards. So we have here the inequality in the context socioeconomic social. We can have here the socioeconomic section. So we have here the division. So the women who can have a concrete education, so in the future have divided into concrete work as for example, as I mentioned before, for the sanitary work or for the care environment, since while the woman can be dedicated to a certain or specific jobs. Also, it is a disequality distribution between women and men, between sectors or jobs, tasks, and also as job occupational. So these risks management are very different. So it's very important to understand that this risk management for social security or security in the workplace can help to uh, to stop these differences between these inequality differences for the welfare and security for the employee. And also, I would like to highlight we have to take into account not only the gender, but also to go more about this sex and gender. There is a difference, intersection difference. For example, in age, rationalized people or class, all those things are synergical, and sometimes it can be more prejudicial for the collective team for women that we women goes into the main topic. So it's something that we have to take into account. We will start talking about the risk in the gender dimension. And also, it doesn't mean that there are no men that can get sick or are prevented for this psychosocial risk. But these things talk about that the women can get more sickness or can get sick frequently. And also, this is something that are present some stereotypes of gender. And also, they can suffer from musculoskeletal diseases I mentioned before. The risk to have stress or this major stress and also the double shift or double presence we mentioned before that they can make difference into these concepts. And also talking about the specific risk imply for women and also the women suffer these things due to biological things. So sexual segregation or the vertical segregation, as mentioned before, it is related to the reproduction or maternity. So because women are more sensible. So we went have taken off this gender the difference, have to reduce into these four topics. If we reflect more about this, there are some questions that can affect all women, but not all women. So it can occur in a certain times in their lives. So there's something that we cannot talk about that is not helping women when we talk about the women rights. So we have talking about before about these examples and the difference between gender and sex. So when we talk about women, we also have to talk about psychosocial risk and also a gender dimension in social psychosocial level. So in this case, I will not talk about all of them, but I would like to highlight that from my point of view is very important. And low control and high demands that are violence into the workplace is very specific for women. Eh, on the low control and high demands, this control can imply for all the social help. These may have a high dimension, empiric dimension, so they can manifest that while women are more favorable, they have commission for psychological demand and low control. It means that there are situations where we have a high attention, not only in mental health, but also in physical health. And we have here many research about that related to the cardiovascular diseases. And also we have some studies that are very important to understand why I highlight the low control and the high demand in the gender perspective. So I have demonstrated that this condition is related to feminist activities that are more precarious. So as you can see here in the share, there are some information related to the last survey. We can see here from the 2015 year. We have here some information that are in related to control and autonomy and the difference between men and women. In some executive occupational jobs are more are employees that employees are men. In these jobs, have more control and autonomous. As we mentioned before, for as models, previous models, they highlight the control, how the occupational resources are mainly important that have the demand or for the psychosocial risk and the security and health for the employees. And so I would like to talk about the violence in this very specific for women and also like sexual harassment that make reference to any sexual behavior. This topic of sex can become connected into the sexist topic. So imagine that where you are developing a masculine sector, the presence of women who have a manager position, they can be submitted to a rejection. So also it happens with men. For example, men who are dedicated into cleaning occupation, they can feel cannot feel good from the part of other employees, women employees. Finally, I also want to talk about the strategic topic, for the prevention for occupational risk in this gender perspective. All these provisions and actions that can be done in the company can be evaluated into a gender approach. For this, so it can be take into account for certain items for the prevention and the equality for difference in specific activities. For these variables, we have four special scenarios where they cannot difference are not recognized. And we can hear preventive politics that cannot be sensible for the differences between genders, between a company that can provide a risk prevention equipment. Certain equipment cannot be adapted into the morphology of women. Other possible scenario is when can promote specific activities, but these activities are not specialized or focused in the gender inequality. For example, a company that only have an approach from a more biological approach for the maternity due to the sex, it, just to understand that these care things can be being charged from women. Not only that can increase women life, but also for the old employees. Other possible scenarios that can be recognized as difference, but are not promoted for specific activities. For example, imagine that we have disaggregated date this for the women into the work environment, and these results for this analysis were not get in this sense. Now, in the European Union, the European Board have approved a limit that we have to take into account the period of lactancy for the women, and also that some women can be excluded from a certain job activities as discriminatory field. And also, these specific activities are promoted, and these politics or provisions can be sensible for the difference between genders. 5 minutes left. We only missed five more shares. And also, we can start doing a diagnostic for the situation for the occupational jobs, disaggregating this information from between sex, and by applying this conceptual framework about what are the difference between sex and in the gender between women and men, and the inequalities, taking into account diversity of the women, or also perspective in the age or class, taking into account also that we don't have a great majority of tools that can approach the perspective of gender, and we have to design a methodologic process, and also to there's a very important opportunity to have a synergy to provide plans of inequality. To conclude, from our point of view, from this general perspective, we have only more to do and to have more research about this topic. in our job occupations. And the important thing is that due to provide this preventive process, taking into account not only the psychosocial risk prevention and also social security systems, and also for the inequalities, ecological differences between temperature things. We women and men, we are not similar. So there are studies that can provide information about that the difference for menopause and the temperature difference between women and men, and also this affects more for women. Also the topic for sensibilization and training, and also for the participation, more active participation for women in all work teams in representation for all workers in topics for health and security. Thank you very much for being here. Thank you very much for inviting me for being part of this seminar. Thank you very much. This is a topic that is very important. I can to make us to ask many things that sometimes we haven't taken into account before. So thank you very much. I know that the audience are very happy for your exposition, and we hope to having you in other sessions with you, so you can share more knowledge about this topic. And also, just to conclude, I have the honor to present our last session, which is a result of the interest that have demonstrated for the last years in the American Commission for Patient and Risk in the topic for psychosocial topics. Our last session is in charge of Dr. Javier Garcia Rivas, which is being presented at a study for the circulation and the psychological risk factors study results of the region and service sharing to identify legislation on psychological risk factors. He has a master's degree in organizational psychology by the Autonomous University of the state of Morelos in Mexico. He undertook a postgraduate course at the University of California, Los Angeles, Oakland, in a diploma in occupational safety and health from the Mexican Institute of Social Security. He has 15 years of experience as a researcher in occupational health and is a member of the National System of Researchers, SNI of CONACYT, a National Science and Technology Council in Mexico. He has been an undergraduate and postgraduate professor in Mexico, Peru, and the United States. He has scientific journals, books, chapters, and specialist texts. He has been a speaker at international events and a consultant on psychological risk factors at work. He is currently a specialist researcher at the Inter-American Center for Social Security Studies. In addition, he has been a consultant and advisor for the Pan American Health Organization, and now for the World Health Organization of the Labor and Health Issues. Dr. Garcia, we are here attentive for your session. And for us as commission, it's a pleasure for you to be part of this commission. And also to help us with your knowledge. Go ahead, please. Thank you very much, Dr. Patricia, for your presentation. And I'm very happy to be part of this session and participating as a panelist. If some of the audience have seen some other webinars from the American Commission on Occupational Risk Prevention and the Inter-American Center on Social Security Studies, we have organized, some of them have had the opportunity to see me in other events. So this day I would like to present the result of a study in Latin America, which is focused into the legislation on psychosocial risk factors. The first part of this study is a certain number of results that have been public. It's a great work, with great effort work that we have been working from the CS jointly with the American Commission for the Risk Prevention from the last years, where I will share a little from the findings and some conclusion that we can get from the legislation on these psychosocial risk factors. We have seen here some of the comments that we have seen here in the questions and answers section. And I ask us if we can share it or the resources or the presentation that we are presenting. So all these sessions in this same webinar are recorded and are shared into the microsite, into the Occupational American Commission on Occupational Risk Prevention. So I would like you to be prepared just to take a photo or just to scan the QR code. So this is the content of my session. There will be QR codes that you can scan and then you can save them in your computer or your device. So just to access for the resources for the webinar and also for the documents we are sharing with you. And also for all the material, support material we are sharing with you from the American Commission on Occupational Risk Prevention. These are some of the QR codes that where you can find this document, which is the identification, analysis, and prevention regulatory study on psychosocial risk factors at work. So what we intend to, the main objective of this study is to identify all the material or tools, legal standard tools that in all countries that can have a certain type of legislation for the prevention and surveillance for psychosocial risk factors. We mainly focused in countries in America, Latin America, and Caribbean, and all member countries from the Inter-American Conference on Social Security Studies. What we found here, I'm sorry, before we can continue with the findings and methodology, I think that it's very important to define what are those psychosocial risk factors. I understand, as Dr. Marina that mentioned in her session, that some of them are already familiarized with these terms, so it's very important for us to specify each of these slides. The ILO defines these factors as interactions between the environment, occupational environment, satisfaction, and the conditions from the same organization. While they interact together, while capacities and needs for employers' expectations with, and also the culture and the personal conditions abroad the joint can influence in the performance of the work, in health and satisfaction on the workplace. It means that it refers that all conditions together within the workplace for which we are exposed as employers, and that have or may have a consequence or positive or negative consequence in terms of productivity or motivation or satisfaction, and also for the employee's health. We generally confused psychosocial risk factors with stress. These topics are related, but they are not the same. So for me, it's very important to clarify this. Once they have legislation, I don't know if the other countries have the same history. For example, Mexico, when have the legislation to dispatch the standard, there were sensationalized topics. Then say that your employees can demand you from stress suffering. If you are employee, you can, and you suffer from sex, you can demand your employer. This is not the objective from the psychosocial risk prevention standard. So it is very important to understand this process from stress. This stress process, without the intention to reduction the complexity of this topic, the stress can be defined as a psychosocial process for as an answer for the environment or demands for the environment. This can be worked from researchers from Cullen and Cillian, the classical researchers, especially what they express here is that when we have an acute or they have a harassment for this stress, there is a biological response from our body and psychological field. Once we feel this demand, going back a little, this demand can be real or perceptive. This demand or threat can be real for a lion, for analogic for the zebra, and the confrontation for the demand or this threat can be also real or perceptive. For example, it means that I can face the threat directly, or as a psychological way, I can reevaluate it is a threat or demand, just to make analysis to face these things that sometimes that we are training for. After this process of confrontation, there is a relaxation. As a scientific mentioned before, the homeostasis is normal balance. What we have to take into account here are those threats are chronic. It means that we have here this threat or biological response. So it is threat or demand continues. This biological response continues. So this threat continues. And after this, we can see disease or symptoms. So this is in this sense how we can determine disease is related to the exposition to these threats. And these threats are mainly known as stressors or psychosocial risk factors. If I ask you in this moment, just please answer in your mind, how do you know that you are stressed? Generally, many people can say that you have a muscle strain or irritability or skin problems. You pay attention of this kind of answer. Generally, we centralize into the symptoms. So it is very important to highlight that these symptoms, in this case for the stress, is already an answer, a certain chronic exposure for these threats or demands from the environment. So this is the main objective that this psychosocial risk prevention have. So it means that to prevent from the demand or the threat. When we talk about these symptoms that afterwards it is converted into disease, It is important to have a general framework from the principle of the main diseases in the world. We have here some numbers from the ILO, and we have also here the prevalence is very high from some of them. However, we have scientific data that every of those diseases are related direct and indirectly with work, and also for a psychosocial environment and emotional psychosocial environment. When I talk about the direct topic, that's because we are exposed to certain conditions, nocive conditions. So we all can develop all those diseases, or we have the prevalence to develop these diseases. And also to adopt non-healthy conditions as tobacco consumption, alcohol consumption, inadequate nutrition, lack of exercise. All of these things are related also with work. And also going to the main topic for this study, we will look to know what are the legislation in our countries in Latin America and the Caribbean. So we create a comparative study on legislation and on psychosocial risk. The main topics were the standards that were published in some sites. That were published in some official sites in each country. So we got the qualitative analysis of the characteristics and components of the standards. We found that only these 6 countries have a certain type of legislation of standards by recommendation for psychosocial risk factors. Mainly as a law can go for Mexico, Chile, Colombia, and Peru. In case of Costa Rica, they have only inspection, and also Ecuador have only an agreement that can talk about these topics, mainly not only for all the psychosocial risk factors, but they have some recommendations for some of this risk. The analysis was centered into the scope of the standards, and just to make sure that they are mandatory or linked, the identification of all of the risk. As I mentioned, not all include this psychosocial risk, and also some evaluation of certain instruments and surveillance for these risk factors, and also for the participants who are implied in these systems, for example, workers, security, or unions. The protection of confidential information, intervention mechanisms, prevention, periodicity of evaluation, or control measures. We are not going to talk about all those topics, but all those topics were that we analyzed. If you're interested on this, you can go back to the microsite of the CAPRT, where this document is available for you. And also the second part of the follow for this second document published that I will publish for you. So we know that we only not have a share. We know that we haven't gathered all the legislation for each country, so we have to review all the countries that we didn't find any information. So we received some feedback from other countries, but they only confirmed that only the 4 countries that I mentioned before are the main countries that have legislation in psychosocial risk factors topics. And also you have here the QR code, so where you can access this document. Please give me just 1 minute. I will share something with you. This is a microsite for the American Commission for Risk Prevention at Work. When you click on investigation, you can find all documents I'm sharing you today, among with other documents. So this is just for you to know or to learn more about the design of the microsite. As I mentioned before, these webinars are also available in this web page. So you can click on webinar, and then you can find all the webinars or all the sessions that we have done within the commission. Going back to the slides. So what helped us to develop the second part of the study is just to confirm that these four countries have relation. And we received the collaboration from other countries like Paraguay, Guatemala, and Brazil, that they confirm with us that they have no relationship between, or they are no legislation in regards to this topic, but they have made efforts from some instances. They have motivated the evaluation on psychosocial risk factors topics. So now, what are the dimensions that are evaluated when we talk about psychosocial risk factors? So we have four main tools. One of them that they know is 035 regulation in Mexican standard. We have the resolution 2646 from Colombia. And we have the project for the Superintendency of Social Security in Chile, that they used and this is a version of the Copenhagen Autosocial Questionnaire. And this is basically that it is very similar to what we use here in Latin America, and which is basically also the CAPSOC. What they consider for psychosocial risk factors or for this exposition for threats or demands that we described before, it is basically for dangerous and unsafe conditions that included in the NOM 035 or Resolution 2646 in Colombia, poor and unsanitary conditions, hazardous work, quantitative demands, fast work paces, some quantitative demands that are related to all those dimensions or factors are contained in a model that Marina already presented in her session. For mental burden demands, psychological, emotional demands, high responsibility demands, contradictory demands. It means that an employer that can give us instruction or ask us to, and they give us another instruction for the other day, or contrary instruction, or it is not related to what he or she already mentioned before, or even though when we have to answer for different kind of supervisors at the same time, the lack of control and autonomy over work, limited or no possibility of development, inadequate participation and change management, limited training or not training, long working hours, influence of work outside the workplace. In this case, it has to do with the point with the influence of family responsibilities, which has to do with this relation and affectation between work and family. And also these all the dimensions that can be analyzed from these instruments and social relationships in the work, as Marina mentioned in her session. The model for control talk about the social support, where he considered social relationships with the work partners and also supervisors, and also the relationship with all the supervised collaborators, work-related violence, the little or no recognition and compensation, and some limited sense of belonging and job instability, or what we talk. Sometimes we talk. I'm sorry, I forgot how we call it. On occupational unsafety. So this is a part that is not considering the occupational risk or physical risk, but it is the lack of uncertainty of the constant risk not to have a job in the next days, months, or even years. So these are the dimensions that we found in the study. These dimensions are sustained into principal models, which is the model of job strain model, which is the demand control social support that Dr. Marina already presented. So I don't have to talk about more about this topic. So what is very interesting is that the topic for demands and what is the most stressful part, and what is very important for this model is that the control or decision margin or social position uh, have a role for those demands, psychosocial demands, or for subjective and objective in the workplace. For example, the topic for control is very interesting. From the basic animal experimentation is detected that in certain groups of mice, they are exposed to certain stressful conditions, either illumination or noise. If they have a bottom from then they can switch off. From then they can stop or switch off this stressful condition. So by this biological condition, they can show a less physiological reaction for stress. This also happens when we do experimental things with human people. So some students in a study, some studies was asked to make a stressful task. So when they are distracted by a sound, and they are asked to finish the task with those conditions. In another group, they ask to do the same with the possibility to turn off or to stop these stressful conditions. However, while they receive the instruction, they have to try to complete this task without clicking on the bottom. So while comparing these two groups, the ones who don't have the possibility to have the control, they develop some stressful stress in comparison with other team, even though they have to accomplish the same task with the same conditions or different conditions. The other model is the effort reward imbalance, where we also have to study for the demands or effort topic and the reward. He says that when there is an imbalance between effort that we provide or the effort that are implied in relation to the reward that we received, it's where we can see psychosocial, occupational psychosocial stress. So it is reward The reward can be seen in the salary or the economic reward. That there is more important topics for part of the reward, but also talks about some other elements as esteem. It means that all the recognition that I can receive from in my workplace, or the feedback on how I provide or I perform my work. And also to have the possibility to have mobility or job security or a job position increase. It means that not all of in the workplace is how I get from salary, but we have to see now from all elements in the model that series shared with us, and also from the model that we have for Robert Karasek. Both models are integrated in each of these legislations from the psychosocial risk. And this is, as I mentioned before, for the previous slide, it is shown that the exposition for all of these risks are associated to chronic degenerative diseases. So, what are the main conclusions? Well, we have found the first one that there are a few countries that have developed procedures and recommendations for evaluation and surveillance of psychosocial risk factors. Also, the diversity of instruments used to establish these procedures, ranging from legal resolutions, official standards, protocols, guides, and recommendations. So there is no legislative standard for psychosocial risk factors. So what we have found here that many of them have this spirit of prevention, focus on the organizational risk factors, not only for the approach or focuses or these factors or these stressors that appear for these symptoms or diseases are developed. Traditionally, this conclusion or of this risk exposition are a charge for the health systems in our countries. We also found here that in some of them there is the absence of obligations and sanctions for the bodies. So it's very important for me that the work that the Mexican Institute for Social Security work that they have been done. So it invites for the employers to taking into account these tools that are offered to accomplish directly and indirectly this current legislation. So there is not considered the effects of its exposure as psychosocial risk disease. So currently, this analysis list has been updated, and I have been surprised that it is being considered that the stress is a professional disease, because the stress as it's very complex to conceptualize it as a disease or occupational disease, as we mentioned before for the previous slides. It is more a process than a disease or exposure or a reaction. So this is all this process. So we have to identify these all diseases that we already have that are related to this social risk, and then we can determine which ones are related to a occupational risk. And finally, some of the main topics that we have to study more about, the diagnostic models developed in a different labor context. Certain of them have a universality level from the demands on rhythms or the control topic, as I mentioned before, that has been developed from the past research. So we also have to keep working to talk about this context. And also, there are non-established labor groups such as domestic work, rural jobs, or technical and specialized services. It is necessary to be aware from the psychosocial or emerge psychosocial risk from the new technologies or the new demands, and also for the new work dynamics. This is all from participation in my message. I will pass the floor for with Dr. Patricia to continue with our question and answer session. Thank you very much, Doctor. We already know that we train or we provide information from all participants in all countries that have not been aware, or some of those countries that don't have of the legislation for these psychosocial risk factors. So we invite them to be aware of this topic. So we invite you to be part of this question and answer session. So we always start with Dr. Roman. Within the questions we have here, and according to the incentive we have here in the LSAC program, what is the percentage for discount for being part of that program? Thank you very much. Good afternoon. Thank you very much for the question. For the calculation for the premium, I mentioned during my exposition that occupational risk factors are going to the calculation variable. So this affect while we diminish accidents and diseases by implementing prevention measures and risk control. So they derive that accidents and diseases are being diminishing. So this is an indirect manner that can influence within the result for the percentage for the occupational risk percentage. Thank you very much, Doctor. We have another question. How can provide quality work for women who work with a certain disease within the workplace? Hello, good afternoon. I don't understand exactly the question. I don't know if the person can explain more the question because I don't know exactly what answer to give. I don't know if she refers to women that already have a certain type of disease, or can you explain? Can someone can give me some context because I don't understand what she's referring for. I don't know. I understand that a woman that already have a disease, occupational disease, how can we contribute to enhance the risk quality in the workplace? So the main objective is to avoid. So for the women, if we're talking about women that are preventive for these occupational risk factors. In the case for we women, if these women already have a certain kind of disease, so we have to provide a tertiary or secondary prevention disease. In this sense, very important is to adapt this occupation for the women in this case, taking into account of these things, not only for the sex, but only with gender that I constructed within the women field, or the main object as preventionist, not to materialize into the women threat. And in case that has been materialized, also just to change job occupation is to take into account these individual factors that can suppose into vulnerability to women health. I don't know if I already answered correctly to that person who asked. I think that you answered correctly because we don't have any more comments. I want to thank you all speakers that you answered to our call to participate in this webinar in commemoration for the social and safety and health occupational prevention. That is very important topic, so we don't have to stop working on it. And also to have to highlight for these elements and the expositions of this webinar invite us to make different things in our work places for also for our employees. And just to conclude that for the audience, you will receive a survey just to evaluate how the webinar was. So we would like you to ask this survey, since this is part of our growth, or to continue to make efforts to enhance health of employees in our region. Thank you very much, Mr. Marina, Dr. Garcia, Dr. Renau, to be part of this session and to share your knowledge for the effort that you made today. And just to conclude, we have to offer you a message that was given for the American Commission for Risk Prevention, for the World Day for Safety and Health at Work. Good afternoon, everyone. I find that in all countries, it is already the afternoon for all countries, and so we give you this message. Thank you very much. Thank you very much. Each day of the World Day of Safety and Health Works, and this day is recognized to all 2 million people who died for conditions related to work. At the same time, every year we try to be committed to contribute to enhance work conditions and equality for the employees. For this annual logo, the ILO invites us to reflect to help processes to implement secure policies for healthier environments. This year, the ILO invites to promote a safety and health work environment. So it is distinguished with indispensable for many reasons: health protection and employee security. A security work environment can protect workers from physical, chemical, biological, and psychological risks that can prevent from risk and death. And management and productivity. A health and safety work environment can reduce accidents, lesions, and also diseases. Workers who feel secure and protected are more productive and more committed for their work. Law and regulations commitment. Many countries in the world have to be to imply regulations for the health and safety occupation environment. To have a safety and health environment is essential to comply with these legislations. So it's a cooperative responsibility. To create a safety and health environment is responsibility for the stakeholders. This is a commitment from a company for the employees' welfare and the society. Attraction, retention of employees. Employees prefer to work in a safety and health environment. To provide a safety and health environment can retain qualified employees. It means just to imply a safety health environment is a right for work, and also because it protects the safety and health for employees, enhance productivity and warranty and legislation and provisions accomplishment, and comply with social and security legislation, and also to promote and safety health environment with gender perspective, imply to have the needs and experiences in the work environment for men, women, and all people that are identified with different gender. And also to promote this safety and health perspective, it can be to make an evaluation of the risk environment that can take into account the gender gap, and also by analyzing the environment and the jobs or the tasks that can affect all different genders. They can help of stakeholders to adopt policies, security policies, to manage our specific needs, to give sensible information for the danger, to give gender information uh, in the specific secured policies in the workplace, how to use equipment and evaluation techniques and good practices to work in different environments. Apply sensible politics for the danger. To apply in general politics for the danger as harassment gender politics, and also to manage violence in the workplace that include all genders. Taking into account all different necessities, employees can recognize all different employees' conditions and adapt them, including to all disability people in maternity or women in maternity for the individual protections and by flexible modalities. Foment a respect culture. To foment an inclusion and respectful environment for the inclusive and gender equality that can provide or enhance gender possibility and equity for to prevent or to apply a respectful environment and behavior. The employers can guarantee that all working population can be protected, included, and valuable, which is leads to a better, productive work environment.